Managing costs is essential, and it's become a strategic priority for every health system right now because there's been a massive shift in mentality regarding what it is that healthcare actually needs to provide. In the past, it was really a system of caring for patients. Now it's a system of health as well. And as part of the economic proposition, there's close to $3 trillion that's spent in healthcare every year. It's going to $5 trillion. So unless we get the growth of healthcare under control, I think everybody recognizes that's a major issue. But on a more micro level, the average health system right now has an operating margin of about 2%. One out of every 3 hospitals is operating in the red. And that's being driven by a shift to outpatient, a shift in payer mix. So volume is down, and the top line isn't growing like it used to. So in order for healthcare systems to remain viable, they need to understand cost and then manage it effectively. Unfortunately, while they may have the mindset to do that, they haven't had the skill sets and the tool sets to be able to do that. So we have this incredible industry that's built around revenue cycle and automation and transactions. But on the cost side, it's really Excel and PowerPoint. So we're in really the first or second inning of the game, and everyone knows they need to be playing it. Well, relative to cost, there's a lot of breakthroughs that are happening. I think the first one, and probably the most important one, is just people understanding cost. So cost accounting has become cool. It used to be something that was done in the corners, but now it's become very strategic. And the reason for that is electronic health records have provided this data liquidity on the clinical side. But on the cost side, which is the bottom part of the value equation, there's really no information. So if you were to ask the average health system, do your physicians get cost information in their hands every day or ever? The answer to both questions would be pretty much no, except maybe in very specific areas. So opening up that information is going to be enormous for healthcare. Right now, physicians and clinicians with their decisions control roughly 80% of the spend in healthcare. But yet, when you survey physicians and you ask them the cost of something, maybe 1 or 2 out of 10 can guess it right. So there's no accessibility to data, and there's no accountability for it. So because of that, there's an amazing opportunity to make a difference just by making that information accurate, accessible, and then actionable. The second breakthrough, which I think is probably the bigger one, I guess I'll counter what I said before, is just the change in the payment model itself. I mean, we're literally flipping the business model of healthcare upside down. So we've gone from this top line system where more equals more to now a bottom line system where you're more capitated, and you have to, if you're capitated in order to make margin, you have to be able to drive costs down. So that flip in the business model for a $3 trillion industry, it's stunning in terms of what that means. And I think it's going to take close to 5 to 10 years for that to even shake out and understand that. And to kind of go back to what I was saying before, on the clinical side, people have put a population health management strategy in place as part of getting their head around that new model. But on the cost side, it's largely, or on the financial side, what systems are being put in place. It's largely nothing. So that's why you're seeing a movement to fill that void with cost accounting, what we call advanced cost accounting, so really making that data liquid. Well, I think the big question as we head into the future is what is value? Everyone's trying to figure that out. And a good example to look at is what's going on in Yale New Haven Health. So what Yale has been able to do is save about $150 million by focusing on quality and that leading to cost savings. What they've essentially done is they've taken clinical data from Epic and cost data from Strata, married those two together, and now they can actually look at quality variation. And this answers a really important question. So everybody says that better care is more cost effective, but no one's ever actually had any data to prove it. Yale has been able to prove it. So when they have one of these quality variation indicators or events, a HAC or a PSI that occurs in a hospital, they know now that it's 4 times more expensive for the hospital, number one. And they also know that they make less money, number 2. So they have actually been able to prove that theory right, that better care is more cost effective. That's a great indicator of the kind of data and the kind of conversation that physicians really want to have. So if you want to look at how care is going to be practiced in the future, how do we provide value, better care, better experience over a lower cost, that is the equation coming to life.